for your patient listening. If you have any questions, please feel free to, yeah.
Next one. I'd like to thank Tanya for the excellent presentation. Just as so that you all know, excellent presentation. You heard it cost billions of dollars for something that we can avoid. And so she mentioned what we can do before we develop the back pain. And my question to you, which I think, in my opinion, is quite important. I think if you do seriously good yoga all your life, what are the chances that you will prevent this?
Yoga is very good. Yoga is very good. It promotes strengthening. It promotes flexibility of the spine. And if you're doing it on a consistent basis, it will really help you. Yes.
Brenda?
Okay. You indicated a good position for a desktop computer. Most of us are using laptops now. What's a good position for the laptop? It's not possible to have the laptop at eye level.
Mostly there are these little tables that are available that you can raise the laptops. You can keep it on the that little table and raise it up so it matches the eye level. So there are equipments available in the market to raise them up.
On that note, just like to suggest that it is possible also to have external monitors these days, which I use a lot.
Absolutely.
So laptop you can port between work and home, but if you have an external monitor, you can even get a good external monitor for about $100 these days. So external monitor can bring that eye level at the right time, and you can also attach an external keyboard. So you have laptop on the side, but you have a keyboard and the monitor, so it should give you the traditional desktop.
Absolutely.
Excellent presentation. I agree
Thank
with
you.
it. Just a short question. You have given the factors that may cause back pain. One another factor I would like to answer. Suggest my friend is taking medicines. Some of the medicines seem to have this effect of back pain. As an example, he takes Lipitor. He takes in the morning. He doesn't take good breakfast at all. Then he used to get back pain for years. Then as a scientist, I said, hey, why don't you try in the afternoon with food? Maybe that might help. And the past 1 month, he doesn't have any pain. So the side effects of medicines become important.
Absolutely, yes. A lot of medicines also they affect the absorption of the vitamins and nutrients in our body. That affects the muscles and the bones and the joints.
The other one question is, it is said the quadrupeds or animals don't have back pain. Is it true?
Oh, sorry, I don't know. I can't be able to comment on that one.
You heard about Lipitor. I just want to comment. Those who are taking statins, Lipitor is one of the statins. There are about 6, 7 of them, different names. And one particular thing you should know, Asians, you and I, cannot tolerate some of these statins. Our enzyme system is such that if you take it more than what is recommended, one of the side effects is damage to the muscle. And there are other side effects to it. So just keep that in mind. You heard about somebody taking Lipitor in the morning and switching to later in the afternoon or evening. Now it may be anecdotal, because have we scientifically done a study to prove? I don't know the answer. So long as it works, keep doing it. Questions? Yes?
You mentioned about the back bending. What does it do exactly? As you said, you usually bend forward to do everything. You never bend backward to do everything. So how does that express that?
So every joint of our body can move in different planes. Okay, so you've watched a 3-dimensional movies. So when you watch a 3D movie, there are different planes, there are 3 planes, right? So similarly, the joints of our body can move in different planes. So our spine has the ability to bend backwards, like that, to bend forward and side, and to twist. So these are 3 different planes that our spine can move. And it's important to move the spine in all the 3 planes, because if you don't move it backwards, then all the muscles that are responsible for moving the spine backwards will eventually get stiff and weak and tighter. And if there is one muscle group of the spine that has become tight and weak, it will affect all the other muscles around the spine to become weak and tight. So it's important to move it in all directions. Okay.
Cold temperature has anything to do with back pain?
That's a very good question. Cold temperatures can cause sometimes muscle guarding. So if you're too cold, you're shivering, you tend to tighten your muscles. That can cause back pain, but that will be really temporary. It will go away. Sometimes people who have conditions like arthritis, these things are still under study. There are a lot of researches going on, but they say that cold temperatures does cause aggravation of the arthritic pains.
Come up.
2 questions. One, regarding the belts, like Dr. Hose or some other, belts are there. Do they have much everlasting impact? The second question is, lot of it depends, like I use the magnetic belt, the blood circulation, if it's proper there, that also helps avoiding the back pain. Your comments on those 2?
Talking about regular belts first, these belts provide support, like an external support and stability to the spine. I personally do not recommend any type of braces or belts to any part of the body, whether it's a knee, its shoulder, its spine, unless somebody really needs it. So if there is a person who works, he has to go to the office or he has to go to his workplace and has no choice and has an unstable back, for those population, I will, yes, recommend it. But for the others, if you're mostly home, you're not doing anything strenuous, I will not recommend a belt. The reason why is sometimes the belts can actually weaken your muscles even more, because they prevent your muscles from working what they normally would if you did not have a belt. So it helps, but it over helps, right? So it actually promotes more dependency on the belt. In regards to the magnetic belts, there's a lot of stuff that's coming out these days. They advertise a lot, that on the shopping channels and stuff. I don't know what they're based on. If somebody wants to buy it and use it, by all means you can. But these are like little fancy things that I don't know too much and I don't recommend too much.
As a dietary supplement, what do you think about high hyaluronic acid? I'm taking some of it. I got it from a company in USA, and I have got problem with my hip joint, and it's really helping me.
If it's helping you, I would say just continue.
But can I avoid surgery because I'm up for one in May?
See, again, that depends on what is the condition with the hips, how bad is it, how long you've had it, and what other things that you've tried so far. Only then
I've tried physiotherapy and it didn't work, and acupuncture. It doesn't work.
Yeah, so I don't know what the diagnosis is, like what exactly is wrong. But just as an example, if somebody has a bad arthritis in their hips, just as an example, arthritis is a condition that we cannot cure. It cannot be reversed back. We can control it to a limit, to an extent. We can slow down the rate of its progression. We can work on the symptoms of the arthritis, like pain and stiffness. But there's only to a limit that we can work on. If the arthritis is severe, then the surgeon decides if he has to, and sometimes there is no option other than having a hip replacement.
I'll answer that surgery in a minute. Please go ahead.
Yeah, 2 aspects. One is the therapeutic aspect, where we already mentioned acupuncture. The other is Ayurvedic, which is very common in India, massage and oil and all that. Whether there are clinical trials done, I don't know, but it is very common in India. The other generalized comment is that among Indians, back home, because they walk without on their feet. There is less problem. The other thing is that we squat a lot. We distribute our weight sitting. When we come to the Western countries, we always sit on chairs and our posture gets modified. So a little bit of going back to the original Indian style may be helpful.
Absolutely. See, whether you're sitting on a chair or you're squatting down or you're sitting on the ground cross-legged, whichever posture you assume, you just have to be careful that your back is your spine is in neutral position, and the curve in your lower back is maintained. That's all what matters.
Please.
Can you comment on the chiropractor services that tend to straighten their backs?
Yeah.
Does that help with that? What's your opinion on that?
Chiropractors specialize in the spine. They have their own techniques. They have their own ways of treating the spine. So it's really hard to say. For some people it may work. For some people it may not, depending on the condition. Chiropractic is mainly based on manipulations. It's a high velocity thrust, like a high velocity force that is put to the spine for adjustment. So if you've ever been to a chiropractor, you would know what an adjustment means. They quickly apply like a force to the spine, adjusting the spine. So their idea, the chiropractic profession is based on different fundamentals. So it's hard to comment, but it works for some.
Please, Jana.
Hi, I had back pain a few months back, and I went to see doctor, and they suggested to use ice packs. And before I went to see doctor, I was using heating pad, and I had a colleague, his doctor suggested to use heating pad, and my doctor suggested ice pad. So I can understand that might be different causes. So is there any easy way to identify, should we use heating pad or ice pad?
Yes. As a general rule, if your pain is sharp or needle-like, burning, it's better to use ice. If it's like a dull, aching and muscular pain, it's okay to use heat. But even more than that, the important part is if your pain is acute, which means it's not been more than 2 or 3 weeks, then use ice. If it's a chronic pain that you've had for weeks, months, years, it's safe to use heat. Ice should not be used when the inflammation or the injury is recent or new and there's still a lot of inflammatory tissue inside the spine.
Good one.
Back pain
Sorry,
can be,
that's all.
back pain can be caused by kidney problem, prostate problem, heart problem.
Yes.
Can you tell us which you had?
Which is what, sorry?
Which you had in the back to indicate you got kidney problem?
These pains are called referred pains. So I would say only a doctor can actually tell you that.
Okay, the kidney pain is invariably on the back because both kidneys are right on the back. And nature has a particular reason to put the kidneys in the back, and the tremendous force of these back muscles. It's not in the front, because if you were in the front kidneys, they'll be damaged very easily. So kidneys are not damaged because they are tucked in very nicely. So when you get infection, kidney stone or whatever related to kidney, this invariably is the back. So that is related to the kidney. The prostate is, the bladder is mostly in the front. So prostate pain will be invariably lower abdominal pain in the front. It can go back, but it will be mostly in the front. Third, your heart pain. So heart pain, it is invariably referred to the left arm, and it mostly goes down. It can go to the back, but not common back. It doesn't go lower back. That's the point I want to make. Go ahead.
Yeah, hi. I was going to ask you about this cushion thing that you mentioned between the vertebrates. Now, I believe they degrade as you age, right? And I'm guessing there's no workaround to prevent it to happen.
You're talking about the discs, right? The intervertebral discs.
It's the gel stuff or the disc, whatever they call it.
Yeah, it's a disc that's comprised of 70% of the water. So as we age, the water gets absorbed and the disc material kind of gets hard and more firm. So there is, it's different in every individual. So people who are more active, people who are more, they exercise often, in them the rate of hardening of the disc is much slower than people who have a more sedentary lifestyle.
So like, I thought, in my case, if I'm very active, is it possible that it degrades and where it's just kind of disappears and then the vertebrates are making contact kind of a thing?
No, that never happens. It can become dry, it becomes fixed, but it's there. It will always be there. It just gets reduced in the height.
I always have a question about using heat or ice, and especially when I wake up in the morning, if I have pain, or if I'm lifting something and suddenly I have pain, I think it's muscle spasm. What should I use, heat or ice, and when should I use what?
If it's a new thing for you, like for example, if you just did something and you thought you injured your back, then I would say ice it. Ice will never harm you. It's like you're cutting vegetables and you get a cut on your finger and it starts to bleed. What would you put? Ice or heat? Ice, to stop the bleeding. That's exactly what our muscles go through when they have an injury. They get hot, they get red, and they start to bleed. But just because we can't see it, we can decide. Ice would always keep the inflammation down and calm it, so ice would never harm. On the other hand, if there's an acute inflammation and you put heat on it, it can bring more blood to that area and it can increase the inflammation rather than suppressing it.
Okay, thank
So,
you.
any other question? Let me talk about this surgery. She mentioned that's the last resort. There are specific reasons why the surgery is done. And people don't do necessarily because you have pain. That's not the reason. There are 5 reasons when the surgeons say, I think it's time to operate. And they will not wait for it. One of the reasons is it affects your bladder. You are not able to make urine or void, or you are not able to go to the toilet to defecate. That's an emergency. So that's one. Number 2, if you cannot lift your foot drop, or your muscle is wasting away, there's no waiting, it's an emergency. You lose reflex, you hit it and you don't get the reflex, that means there is something serious and it has to be operated on. So there are 4 or 5 reasons where the surgeons will say, whether you like it or not, it's an emergency. Now the second thing is for pain. Surgeons will be very reluctant to work and operate on you simply for pain, because the consequences may not be what you want. I'll give you a personal example. In 91, 23 years back, while playing squash, I hurt my back, couldn't walk. Being in the faculty, I was attended by just about everybody. Neurosurgeons, the orthopedics, and you name it. They all said the same thing. No operation. And I couldn't walk. And I wouldn't take any painkillers. So what did I do? I did physiotherapy. Religiously, I did physiotherapy. And I never looked back. Never looked back. I couldn't walk. But today, and since then, I haven't missed days' work. I have pain in the back. It will never go away. So it's not that easy. The surgeon will say, well, look, let me do it. I know a colleague of mine, he had 3 operations and he didn't improve. Then last month, somebody called from Toronto a few months ago, asked me if I should go through the surgery. I asked the same question. And he was limping. So I think it's a better time you go and get operated. And he did. And I'm told by him, of course, that it's much better. Pain is gone and he's able to do some physiotherapy. It will take him years to recover. So surgery is not as a simple answer as people may think. There are certain criteria surgeons look for it. Any other question? Go ahead, please.
When you talk about back surgery, what is actually being done as part of surgery?
Oh, okay. There is something called spinal stenosis. Am I taking it away from you?
No, please go ahead.
Spinal stenosis, as she drew the diagram, there's a hole through which the nerves come out. As we grow older, there's a wear and tear. The little spines come out and compress the nerve. And the hole becomes narrow. That's called stenosis in medical term. Spinal stenosis. So the surgeon will go and try to scrape it and free those nerves. That's basically what they do. And if the disc is pressing it, they may remove part of the disc. Something she mentioned, don't take it lightly. As we grow older, or old, I don't know how she mentioned so casually. It's true. Our bones get so dry that is one of the major reasons, contribute, not the only reason, for our problems. We all get dried up with the age.
Is the pinch nerve related to back pain?
Yes.
Yes. Pinched nerve usually refers to sciatica. Sciatic is the name of a nerve that comes out of the spine in the lower back area, and it travels all the way down to our foot, to the back of the leg and the foot. When this nerve gets pinched or there's pressure on this nerve for any reason, it could be arthritis, it could be just simple muscle tightness, it could be injuries. So for any reason, when there's pressure on the nerve, it causes tingling, numbness, weakness, and some other symptoms, and all of these combined is called sciatica.
So what's the solution?
Depending on the cause of the pressure, so what's causing, if it's only muscle tightness that's causing the pressure, the muscles can be released by physiotherapy. If it's arthritis, and in arthritis, there are small pieces of bone that form around the vertebrae. That sometimes can cause pressure on the nerve. If that's the case, then depending on how bad it's affecting the person, then the surgeons can decide if they need to really work on it. Sometimes it's even the disc that can put pressure on the sciatic nerve. So if that's the case and the disc is really putting hard pressure and it's really painful and causing disability in the individual, the surgeon can decide to go for a surgery. So as Dr. Jindal was mentioning, surgery could be an immediate, sometimes it's like right away. Those are mostly the nerve issues where the nerves are involved. Then that's the case when it becomes a little more urgent.
I'd like to thank Tanya. She has done a very beautiful job and we had a good time for question answers. And I thank you in the usual way.
Thank you.
Now, as we decided last 10 minutes or 5 minutes, we give you an overview of what happened since the last presentation a month ago. People ask questions outside, so I put those questions